Hi, Dr. Choucair again. It's been a few interesting weeks since we last provided a video updating you on our practice. And so I'd like to do that today. Today happens to be May 1st. And so it's been a few weeks, and I hope all of you have stayed healthy and your families have stayed healthy despite the challenges that we've all faced. So I want to update you as far as what our practice is doing. As you probably know, if you know our practice, safety is all that really matters. And we've thought that from day one before this viral pandemic, but now going forward, we're even emphasizing that more in many ways. So we're here today to really educate and inform you, and I hope that doesn't, again, change from our normal mission. Today, the Governor of Texas and the Texas Medical Board, which licenses all physicians, have let all the restrictions expire, and physicians can now go back and practice medicine and surgery as they did before, with obviously many criteria that we meet to make sure that we're safely practicing and not spreading the viral pandemic and keeping everyone as safe as possible. So I want to go through those things with you. All of it is pretty much based on infection control. And so many of these things have been implicit and part of our practice for many years. So the first thing is cleaning and sanitizing. Well, our practice, again, as most surgeons and doctors, we know about cleansing and sanitizing surfaces and after every patient, and making sure that we're not spreading any germs that were around for many years, much less this new virus that is so challenging. So, just so you know, we're doing everything we've done before. We're not having to change anything. We're just more specifically emphasizing it so our patients know that we do these things. We're doing all the other things. Social distancing, we're using masks in our office. All patients are required to wear masks. We have new protocols and criteria to follow that fits with all the local, governmental, and CDC and American College of Surgeons recommendations, and those are constantly changing, and we're following those to the T. As far as, we don't shake hands anymore, which is, unfortunate, but we certainly can greet you with a smile and let you know that we're here. As far as another thing we're doing is we're spacing patients out, and we're doing video conferencing or telehealth, as you probably know. And for patients who've had surgery, first of all, if you know my practice, you can reach me almost any time, whether it's the office or my cell phone, because all my patients get my cell phone if they've had surgery. I certainly want to hear from them. So if you've had surgery and we can eliminate a visit after surgery that can be done by telehealth, we want to do that. Not because we don't want to see you, we don't want you to be exposed unnecessarily. So we've transitioned many aftercare issues to telehealth, which worked very well, and I think patients have liked it. So we'll continue to do that, and maybe even new patients, to limit your exposure in getting out of the house. As far as screening, we are doing screening just like everyone around the medical community. In our building, as you know, it's a medical building, so you can't even enter the building until the nurses downstairs check you. Those wonderful ladies and men who man that desk every day and check your history, your exposure. They take your temperature, and they give you a sticker, and they make sure you're wearing a mask. Then you come up to the office, and again, we hopefully don't make you wait at all. You come right in. We're trying to be very careful about that. So there's no one in the waiting room. There's no magazines for you to touch, and so we're very careful about what you could possibly touch that could be passed on. So we're doing all those screenings, and of course in our operating room, our screening system is even greater. If you're going to consider having surgery, our anesthesiologists have been screened, all our patients are screened, and of course all the staff are screened just like anyone. Finally, what about testing? Well, we are testing patients for COVID-19, and that is a test that's called a PCR test, and it determines whether you have COVID-19 at the time of the test. It actually is a nasal swab, and also there's a technique of sputum or saliva that can be collected, and to determine whether the virus is in your system by getting the RNA of the virus and detecting it. And if it's positive, it's very strongly specific. If it's negative, it doesn't necessarily mean you don't have it, but it's a very high chance you don't. It all depends on the technique of taking the swab. And so our nurses are trained in doing the swabs on your nose. Insurance covers the PCR testing for basically everyone. We send it off and we have an answer in 48 to 72 hours. We're doing that for every patient who's having surgery to protect everyone who comes to the office and also the staff. In addition, we can test for antibodies. This is a different test. This is the test where you take blood from the finger or you draw blood and you determine from that blood sample whether you may have been exposed. And you're looking at antibodies called IgG and IgM that tell us different things. This test is still in the infancy of what it really means and how specific and accurate it is. So we do have that ability, but we're not really sure how to use it completely yet. So the PCR testing that determines whether you have the virus, which we want to do within 2 to 3 days of doing surgery if we can. So then you self-quarantine, then we do your surgery so we know you're hopefully negative. And if you have elective surgery and you have an asymptomatic case of COVID, it could make your recovery worse. So we want to know, and that's what we're doing. So in summary, those are the things we're doing to try and keep you safe. If you elect to have any procedures or surgery with us, we feel confident that we're going to do everything we can going forward to adjust to any changes, and we're ready for it, and our staff is ready. And so if we can help you in the future, we're here to be your advocate, your guide, to be a resource, and to continue to educate you about options. And so if we can help you, let us know. We're here. You have our number. And if you're not ready, but we can be of any benefit, if not more than just a kind word and a friendly smile, we're here. Take care.